Europe is in the middle of an intense third wave in the coronavirus pandemic. In France, more than 100,000 people have now died from COVID-19. Meanwhile, Germany is seeing its largest rise in new infections since early January. That is despite vaccinations picking up pace. New national controls have been approved by the country's cabinet, but they could take another week to pass through parliament. Doctors and health officials are pleading for immediate action.
On Germany's intensive care wards, this is what the third wave looks like. More than 29,000 new COVID-19 cases were reported on Thursday, the highest number since early January. Doctors are warning that in parts of the country, only 10% of intensive care beds are unfilled. The head of Germany's Public Health Institute is alarmed.
It
is clear that we need to act now on all levels. Above all, the decision makers need to take action. We need to reduce our contacts now, break the infection chain now, and save lives and the health of many people. But not all decision makers share that sense of urgency. In particular, some regional leaders have been reluctant to implement tough restrictions. Now, Chancellor Merkel is introducing a change in the law to grant the central government temporary powers to enforce lockdowns in areas with high infections. But even for the health minister, this could be too little, too late. I already said a week ago that we needed extra measures and that we needed to take firm action. Time is not on our side, and everyone already has the option to be taking measures. They need not wait for the law to be finalised. The new nationwide regime mandates school closures and contact restrictions when infection rates hit defined levels. Much of the public supports tough action, but critics say the focus is too much on limiting personal freedoms, for instance with the proposed introduction of nighttime curfews. A lot of people of my age will just meet at home in secret. Curfews won't get this under control. People will meet privately. I don't like it. You can't do that with people. I also like to be outside and meet people, but I think we just need to shut things down for 4 weeks. Those who didn't follow the rules before won't listen to these new laws, but those who did obey feel they're being treated like fools. Restrictions in some parts of Germany have been light for much of the pandemic, but as laws are tightened, people here are having to face the fact that coronavirus not only costs lives, it corrodes liberty as well.
Well, the debate over whether to grant the central government more powers for pandemic management is currently playing out in the German Bundestag. Earlier, Chancellor Angela Merkel made her case to members of parliament.
If we've learned a lesson 13 months into the pandemic, it's this. The virus doesn't forgive any half-heartedness. It only makes things worse. The virus doesn't forgive hesitation. It just makes everything last longer. The virus doesn't accept any negotiations. It understands only one language, the language of determination.
Our chief political correspondent, Melinda Crane, is following the debate at the Bundestag for us. Hi, Melinda. We saw Chancellor Merkel making her case there earlier. Are we going to see German lawmakers today finally take those steps that public health officials and doctors really are pleading for?
The Chancellor gave quite a vehement defense of this draft law, and the government had originally hoped for action this week, but it's not going to happen here today. In fact, policymakers are now saying it will take at least another week until the law passes both chambers of Parliament, and even then, some provisions, including, for example, the curfew, could wind up being challenged in court by members of the opposition. So it will take a while. It's not going to get here quickly enough to stop this third wave in its tracks.
We're more than 1 year into this pandemic, Melinda. Why is there still no clear consensus among Germany's leaders on how to tackle it?
Well, as we heard in the report, one reason is German federalism. Until now, the country's infectious disease laws have put most of the responsibility for pandemic management in the hands of the federal states. And because infection rates and conditions vary from region to region, there has been quite a discrepancy in the way that different federal states have interpreted the rules. And then there's very justified concern on the part of the policymakers, and we've heard this in the debates here today, about incursions on basic freedoms that are guaranteed in Germany's constitution, and particularly when it comes to rather drastic measures like a curfew. So we heard the Chancellor in her remarks talking about the need for proportionality between burdens and benefits, but crafting a law, crafting a curfew restrictions in order to ensure that kind of proportionality can become a matter that drifts into micro-regulation and hair splitting. And we're also hearing some of that here today. Interestingly enough, among the broader population, there is pretty strong consensus on the need for tighter measures. And even on the curfew, and maybe we can take a quick look at the statistics there, even there we see a slim majority of Germans and nearly all supporters of the governing parties and the mainstream opposition parties supporting a curfew, with 46% nonetheless skeptical.
Melinda, just quickly, we have seen a glimmer of hope this week with vaccinations picking up pace. Will that be enough to break this third wave?
Not for quite some time. We're now just short of 18% of the population having been vaccinated for a first time. But as you know, herd immunity requires that a large majority of the population have been vaccinated and become immune, and we're still a long way away from that.
Our chief political correspondent, Melinda Crane, reporting from the Bundestag for us. Thank you very much.